Good morning, Recovery Reinvented. Wow, 6th year, you are part of an incredible, amazing community. All of you that are here today, all of you that are watching online, the thousands that are watching online from states across the country, it's the power of you. You matter. Your voice matters. Your presence matters. You're making a difference. Today is a day of gratitude. It's a day of celebration. It's a day of inspiration. You're going to hear powerful stories throughout the day. You're going to hear a very powerful one this morning, very shortly from the First Lady. But working together, all of us, all of you, the state of North Dakota, all of our partners in communities, faith-based organizations, providers, everyone coming together, the positive momentum we have in North Dakota that's spreading across the country in terms of how we're approaching the powerful, pervasive disease of addiction. And this is a disease that's chronic, and if untreated, it's progressive and ultimately fatal, and we need to treat it as such. But here at Recovery Reinvented, we're focused on a few things. Number one, eliminating the shame and stigma of this disease. If we do that, more people will seek help, and we'll have the right kind of policies to approach this as the disease. Number two, increasing access to behavioral health supports in the community. And then three, creating a culture, which all of you have such an important part of. That culture where we normalize the discussion where it is a disease. As you just heard in the video, the First Lady saying, we believe that behavioral health, mental health, the disease of addiction, it's all health, and it should be treated as such. By focusing on the foundations of well-being, the physical health, the behavioral health, and the economic health, we can continue to grow as a strong and healthy state. As always, I want to kick off the day with gratitude. And there's so much gratitude to spread around here. The people that have helped produce this conference on the behavioral health team, the Recovery Reinvented team, the governor's office team, and so many more. But I want to just say again, you saw him right here on the stage kicking it off, but grateful for the leadership of Jonathan Holt. How great to have him jump into this role as managing director of the Office of Recovery Reinvented. As an entrepreneur in our state, running businesses with recovery supportive environment in those businesses. And as a speaker last year, he's focused on community, on people. He's used his lived experience as a person in long-term recovery to ensure that we're creating this intentional space for people in recovery, their families, their friends, their coworkers, and everyone else to be in a position to support recovery. And so, again, Jonathan, let's give it up for him one more time. Fantastic work. We like to think that Jonathan had so much fun last year as a speaker that he just had to come to work for Recovery Reinvented. But then, of course, as he did, then he said, well, we're going to hold Recovery Reinvented in my hometown of Grand Forks. So it's great to be here. And we have so much support from the community of Grand Forks. I know that we've got right here in the front row, we got Mayor Baczynski. Stand up, sir. Thank you for your great leadership. Appreciate everything you're doing. And of course, the Grand Forks community wouldn't be Grand Forks without the University of North Dakota and University of North Dakota Medical School and all the health services. And we're really honored to have UND President and First Lady Andy and Kathy Armacost here. But Dr. Armacost, thank you for your leadership. You'll get to hear a few words from both of those leaders later this morning, but I also want to say gratitude to all of our generous sponsors, our event partners, Livewire, who helps produce the show. They donate their time and services to help make this possible, but everybody for delivering this impactful experience, everybody working online. I want to thank all of our vendors that are here. It's great. We've got the vendors in the room this year, so be sure to take advantage of all the services that are here, but it's great they can also be in the same room and listening in. But man, Jonathan mentioned it. We've got fantastic keynote speakers today from around the country. We've got recovery storytellers. They're all being super courageous in sharing their stories of recovery. I'm looking forward to all of that coming up today. But before we get into our first keynote, we need to talk a little bit about how serious this problem is. We knew we had an issue in 2017 in our country and in our state when we said we need to take a new approach to how we think about the disease of addiction and recovery. But where have we progressed since then? In 2019, there were 76 overdose deaths in North Dakota. In 2020, 115. Last year, I'm sad to report, a record high, 131 overdose deaths. And not looking good this year through October, early part of October, 74 overdose deaths this year. And you'd say, okay, well, what's happening? Well, we want to blame a lot of different things on how that might be happening, but it's clear nationally in the data that one of the reasons that this is happening is the huge influx of fentanyl into almost every other drug. Fentanyl with meth is a new thing where you've got depressants and stimulants together in the same package are super dangerous. And then of course all the fentanyl, it's very cheap. A lot of it's coming over the southern border into our country, and it is. And if you think this is a southern states problem, we created a new drug task force, interdiction task force, as part of the North Dakota Highway Patrol. We took 5 people on our highway patrol. We didn't have more FTEs. We didn't have more budget. We just transferred people from one job and said, you're going to focus on this. We had a strike force that included a collaboration with local and federal and other in 1 week focus on our highways in North Dakota in August. We seized over 25 pounds of meth and 7.7 pounds of fentanyl. Now, yes. That's the good news. 2 milligrams is a fatal dose of fentanyl. 7.7 pounds of fentanyl being transported across a road in North Dakota. That's enough fentanyl to kill every man, woman, and child in our state twice over. That's how much that drug was just passing through here. Fentanyl is being included in all kinds of products. The reason why we're seeing higher risk and why we've got to get the schools involved and parents involved. Catherine and I were at a residential facility in North Dakota talking to some 14 and 17-year-olds about fentanyl, rainbow fentanyl, fentanyl that looks like sweethearts, fentanyls that are available in schools across our state. And I realized that these kids knew more about drug supply than almost any of the adults and any of the professionals that I talked to. We have got to get a conversation going with our youth, and I mean youth like junior high youth, to really understand the degree of what's going on in our state right now. And that's important for all of us as parents, as leaders, as people talking to teachers. Our schools have got to do more drug education because it is there. When we talk about overdoses nationally, last year there was nearly 108,000 overdose deaths in the United States. Think of that. That's like everybody in Grand Forks, man, woman, and child, times 2, died last year of an overdose. But I think we should stop using the word overdose when we're talking about fentanyl because there is no appropriate dose for a lethal drug. Nobody is trying to just say, no one's trying to say, I want to take the right amount of fentanyl. I mean, it can be lethal the very first time you take it. And so, and if it's being put into drugs like Adderall and other drugs that kids in high school might be taking that they think are sort of the cool drugs to be taking, but it's been stamped with fentanyl, well, that's how we're getting some of these overdoses. We have had overdoses of junior high kids in North Dakota in the last month. So I'm not the person that's usually like, let's all be afraid. I'm just saying, let's all be aware that there is something here that we can't be blind to. So as we move forward with with understanding this human cost that we're facing both nationally and within our state, and again, when I throw out these big statistics, 108,000, hard to imagine, the 131 in North Dakota, hard to imagine. But think about that each one of those is a brother, a sister, a son, a daughter, a family member, like someone that you know that may be struggling with addiction. Those are the people that we have to be reaching out to right now, and that's who we have to be working to try to protect and educate. So Recovery Reinvented is more than an event. It's not just one day, it's a call to action. And the call to action includes includes more awareness about the danger we're facing, but it also includes this focus on ending the shame and stigma that surrounds the disease of addiction. And we've brought together through this event providers, elected officials, people with lived experience. I know we've got some legislators that are here in the audience today. Thank you for your support in helping to drive the right policies. We know everyone here and everyone online can play an active role in helping us reinvent recovery. And throughout the day, we're going to provide examples and opportunities of how all of us can be advocates in action and be more effective when we leave here today than we came. You came because you care. We want to harness that care and give you the tools to help you drive forward and inspire you through the speakers and storytellers that you're going to hear from that are shining examples of individuals whose lives have been touched by addiction, in some cases nearly destroyed by addiction, but by maintaining that hope and that dream, they've come back, and in recovery, they're making a huge difference for everyone else. That's what's possible for everyone, is turning that action, turning that advocacy into action, because that's reverberated across individuals and families and communities and workplaces. In our work, it's important, that we approach this issue from all angles, and I just want to quickly say that we all know this, that addiction touches every family in our state, every company in our state, every community in North Dakota. And in government, you might say, well, what's government got to do with it? Well, it touches government in every possible way too, and it touches all of the 5 sovereign nations, the 5 tribal nations with whom we share geography, and we are pleased to have their support and participation today. We're flying the 5 flags here today of our great proud nations that we share that geography with. And there have been many, many times in history and many states that don't try to figure out, the state doesn't try to figure out how to work with the tribes because they say it's a federal issue. Yes, the federal role with the tribes complicates every aspect of how we often work together. But I know one thing, and our administration knows one thing, and the First Lady and I know one thing, that every enrolled member of a North Dakota tribe is also a North Dakota citizen, and we are neighbors. Knowing that the disease of addiction was a big issue in our state, when we got into office, government's always about budgets, budgets, budgets. Bigger budgets means good news, and lower budgets means less news. Everybody focuses on inputs. Nobody focuses on outcomes. We're trying to shift that. I came from the business sector. You focus on strategy ahead of budget. You don't brag about your inputs. You brag about your outcomes. It's not about how much you spent, in your business in a year. It's, how much revenue you got. So it's like we're focused on outcomes. So we went into this and we said, instead of a budgeting process, to start with a strategy process. We did 70 strategy reviews over 4 months with every possible agency in the state. And we went through all that and we asked each of them, how does the disease of addiction affect your agency? And we got back at the end of that, and only 2 agencies out of 70 actually had a line item in their strategy and budget for addiction. It was Human Services and the Health Department, now combined in North Dakota to the Health and Human Services. So really one organization. But as we had that discussion with the judicial branch, and I'm in the position where if a judge retires or leaves, there's a process where I get submitted 3 names and I get to pick the next judge. When I interview those judges, and now I've interviewed close to 50 of those individuals to select judges during my time, and I say, how much does the disease of addiction affect your role in the judicial system as a prosecutor, a defender, a judge advocate, someone who's wanting to become a judge? And they all say, well, if the disease of addiction was gone, 80% of my workload would be gone. Our judicial system today is an intersection of this disease. So think about 50% of the cost of everything we've got in the criminal justice system. Then you go from the judicial branch, then take Department of Corrections. We spend about $500 million every 2 years in North Dakota on corrections and rehabilitation. Okay? $41,000 a year and growing for someone who's incarcerated. I mean, we could send them all to UND, and there'd be money left over. I mean, it's like to house them and feed them and provide the medical care. But we're often, when they're in incarceration, 80% of the men and 100% of the women have a substance abuse disorder. Are we providing the right kind of care for them when they're there, if they're there because they have a disease, if that's what drove them there? And then we had other agencies that said, well, no, we're not affected by it. But what about North Dakota Game and Fish, North Dakota Parks and Recs? Game and Fish has got badged licensed officers. You know, they're called rangers. You know, in the Parks Department, they're called wardens in the game wardens in the Game and Fish. I asked those folks, well, do you ever run into this stuff? Well, if you've got an issue that's happening with somebody that's hunting illegally or someone that's doing something illegal in our parks, or there's a fight in a campground in a park, guess what? It's usually tied back to some kind of substance abuse. And then you just keep going down the line. Turns out that all 70 agencies were touched by the disease of addiction. I think in our estimate that of the over $17 billion that the state of North Dakota manages across federal and state programs over a 2-year period, that close to $1 billion is impacted by the disease of addiction. So part of the reason we're here is not because this is yes, it's a problem for an individual and somebody you know, and it's intimate in your family, but also in the aggregate, it's a really big problem that's not being addressed appropriately, you know, yet by our nation as we go forward. So little things matter. So in the whole of community, you know, what do we have? We've got small agencies like the Department of Securities, led by Karen Tyler. She provided Narcan training to all of her team members. Department of Corrections and Rehabilitation has been a great partner. They continue to address the disease of addiction by, you know, increasing access to effective medications, providing peer support training for those that are incarcerated, and the services that we're providing to people both in and as they get out of the judicial system, getting better and better to try to reduce that recidivism. Highway Patrol working on expanding their mental health supports by including options for behavioral health professionals and first responders who go through trauma in our state. We have other examples. Schools across the state, at all levels, we've identified that behavioral health is a super significant need. We're trying to get addiction counselors and counselors into every school in our state so that if a child has got a situation at home with a parent or parents that have issues with the disease of addiction, they understand it, they've got someone to talk to. And that we're trying to increase the funding for behavioral health team, increase access to services across behavioral health across all of the state. Through Vision Zero, again, we had in the nation 42,000 highway deaths last year, always about half of those related to some kind of substance abuse and, you know, driving in an impaired way. And so our Department of Transportation, Highway Patrol, Vision Zero, working very hard on this to try to eliminate motor vehicle deaths and injuries in our state. Human Services, Health and Human Services, Recovery Assistance Program last year, providing support to individuals in recovery by increasing access through supportive housing environments. So we keep chipping away now with every agency. Everybody's got something to do. When we did the strat reviews again this year, everyone's got a goal of what are you going to do to try to keep making progress against the disease. So when we say whole of government, it's not just words. When we say whole of community, it's not just words. We actually, in North Dakota, have a movement where everybody understands the importance, but nobody understands it more than all of you that are here today, and that's why you're so important. The Department of Health and Human Services has continued to invest in opportunities to expand the peer support workforce. This is something unique to North Dakota. We knew that we had an issue with a shortage of licensed addiction counselors. We have a shortage of people with behavioral health and mental health experience. They're west of Highway 83, which is Bismarck to Minot, North Dakota. I do not think still there's a single psychiatrist in that entire part of the western part of the state. And peer support, we know from the studies, is effective, equally as effective. Connection with someone with lived experience, it can significantly improve the life, engagement, and satisfaction. And the way we've set it up in North Dakota, where peer support specialists can get certified they can get reimbursed now through Blue Cross Blue Shield. They can get more compensation if they help the people they're working with get a driver's license, get a place to live, get a job. I mean, the basic fundamental things that support recovery. We have now trained 791 peer support specialists in North Dakota. 183 of those have completed the process to become certified. I would just like right now, if you have gone through peer support training and you're here today, could you please stand and let us say thank you to you, all the peer support specialists in the room. Look at that. If you are someone who's gone through the training and hasn't completed the certification, I just have 2 words. Get certified, and then 2 more words. Get certified, then start getting reimbursed by Blue Cross Blue Shield. You are part of our healthcare network. You matter. Thank you for the work that you're doing. Free Through Recovery, which we announced in 2017, which was a new program unique to North Dakota, Department of Human Services and the Department of Corrections and Rehabilitations, which I say has been a great partner. It was a community-based behavioral health program designed to increase access to recovery support services for individuals that were coming out of the criminal justice system. Free Through Recovery offered care coordination, peer support, other recovery services that impacted the participants' lives and helped them on this road to recovery. That program is working. It's absolutely working, and it's working because of our peer supports. But now we're seeing even a bigger impact because we said, hey, if it works for people coming out of the criminal justice system and we don't want them to go back in, wouldn't it be great if we just walked upstream, as Dr. Don Warren always talked about? Let's go find out, instead of pulling the babies out of the river, let's go up and find out who's throwing the babies in the river. We want to go upstream and say, hey, through this new program, Community Connect, it's the same model, but we provide services to individuals who have not yet got connected with our criminal justice system. Before there's a child welfare involvement, before there's criminal justice charges, before their housing is lost, then we can get to them and get service to them. We to date, between these 2 programs in North Dakota, the work of all these peer support specialists and the people involved in Community Connect, we have now touched more than 8,300 individuals through these programs, and that number is growing every day thanks to all of you. In July of this last year, the National 988 Suicide and Crisis Lifeline went live. People that are experiencing a mental health crisis can now call or text a 3-digit number, 988, to reach the National Suicide Prevention Lifeline. In North Dakota, that 988 Crisis Lifeline is answered by First Link. And First Link number's been out there for a while, but again, now very simple. And if you're having a law enforcement issue, someone's breaking into your home, you've had a car accident, call 911. But I want to be clear, you don't have to be on the verge of suicide to call 988. If you know somebody who's struggling, if you're struggling yourself, if you're having thoughts that are making yourself uncomfortable, if you don't know how to get access to services, 3 numbers, 988, just dial it. It's confidential. It's right when you don't have to give any information, just dial it. And the service is there. Let's use it. Recommend it to your friends. If you don't know how to help someone else, write 988 down on a piece of paper, stick it in their pocket, and say, hey, when you're feeling very low, please call this number. Let's just get people driving towards this number as that very immediate, quick thing to do. Also, Health and Human Services is launching a new directory. You can learn more about it over by the giant billboard-sized sign over here in the back of the room, but it's a directory. So if you're saying, hey, I'm ready to get services, but I don't know what services are available in North Dakota, they're compiling a directory for all mental and behavioral health programs in our state, the kinds of populations they serve, the kind of specialties, whether it's eating disorders or depression, whatever it happens to be, what are the treatment options, what are the intervention options, what do you have to pay for, what's free, what's the telehealth options. All of that can be addressed through this one directory. So again, I want to say again, thanks to all of our agencies as we continue to work as one to turn advocacy into action. So two things, 988, the hotline, and number two is the directory for services. Good resources for everybody here to know about when you're supporting friends and family. One of our biggest goals over the past 6 years is reframing addiction from a choice or a moral failing to something that is a public health concern. Why does this matter? We have to change the hearts and minds around addiction if we're going to end up with the right policy. Changing hearts and minds includes great data. North Dakota, we always said we're going to be driven by data, not by ideology. The First Lady's been fantastic on this point. She drove and said, let's do the survey, let's get it done. She knows data changes minds, data drives funding, and data can help shape policy. And let me just think, if you were a policymaker, if all of you were the legislature, and you thought that the disease of addiction was a moral failing or a choice, you'd probably come up with a policy that said, well, we don't want people to make that choice. We don't want people to make that choice, so we're going to increase the penalties if they make that choice, because then they won't make that choice. Because if they make that choice, the penalties are going to be so steep that they'll just stop making that choice. But if you understood that it's a disease and it's a brain disease, and once trapped in the disease of addiction, that's not how the brain works. The brain is seeking to fulfill what it was missing from that addiction, from the opioid, from the heroin, from the alcohol, whatever it is, the brain is seeking that. That's the powerful thing that makes you, ignore your children and make bad choices and drive when you shouldn't. Then all the penalties in the world aren't going to matter. And that's why we can end up filling up jails with people who've got a brain disease. And I liken it to if we thought that diabetes moral failing or a bad choice. I mean, would we ever say to somebody, hey, here's 28 days of insulin, and if you relapse, we're taking away your insulin and we're going to put you in jail. That'll show you. You won't be a diabetic again after that, after we sentence you. It's like, no, we have to treat this health issue as a health issue. And yes, people that are selling drugs are criminals, and they need to be prosecuted. We need to have law enforcement against the people that are selling the fentanyl. But the war on drugs should be on the people that are selling the drugs. It's not the enemy combatant. It's not the person that has the disease of addiction. That's the person that we have to take care of. So we have to have both of these things at the same time going on. Both of those things can be true. Tough law enforcement, make sure the fentanyl's not coming over the southern border, and make sure that we're taking care of people who've been trapped in the disease of addiction. But one of the innovative ways we've gone in North Dakota to study the attitudes and knowledge surrounding the disease of addiction and recovery was to do a survey. And in this case, we said, let's survey. We surveyed 2,300 people. That's a big survey. 500 for the state of North Dakota would get you statistically correct. We did almost 5 times that. And between 2008 and 2021, the number of people, if you look on the left side of this chart, we started out in a pretty good spot. 2 out of 3 people thought that the disease of addiction was a disease. And 1 in 3 said, no, people made bad choices. It's a moral failing. Now, 3 years later, in 2021, we've moved it up to 3 out of 4. So we're now at 75%, or 75 out of 100, or in this case, 9 out of 12 in the slide, where people would say, no, it's a disease. It's a disease. And this matters because policymakers listen to you, and policymakers are influenced by an understanding. If everybody understands this is a disease, we'll start building policies that are based on public health supports, early intervention, treatment, as opposed to punishment. So this is real progress for us and super important. And again, the First Lady key to making all of this happen. And our efforts there have shown that the power of storytelling, because people telling their stories is what help people understand the situation we're in. The mission at Team ND is very simple, powerful 6 words: empower people, improve lives, and inspire success. Recovery Reinvented, and all of you embody the spirit totally as we collectively work to find ways to put our arms around this huge challenge before us. So part of my gratitude goes to all of you for your work. When you tell a story, when you tell your story, you're empowering people, you're improving other people's lives, and you're inspiring their success. And the recovery does begin also with humility. For that last 1/4 of North Dakotans that think it's a moral failing or a bad choice, for them to get on the side of, hey, it's a disease, it's very hard, because guess what? They have to have the humility to actually unlearn something. They have to unlearn the misconceptions, the prejudices that they may have been taught by their parents, they may have been told, it may have been some organization that, that created that shaming mentality in their lives, or an institution that said that. So for us to keep making progress, it's hard, because people, to come to the understanding that this is a disease, they have to have the humility to say, what I thought was true before may not be true. I have to have the humility to understand that as I grow, I can learn, and things that I held on to that I thought were true may not be. They have to have the courage to be curious about finding new solutions, and the courage to try things that may go against what they or those around them thought was the right answer, like more punishment always solves the problem. But we're making progress on this. And today, I think the key thing for all of you, if you came today and you're on a search because you know someone in your life or someone that you're working with who's struggling, and you don't know what to do, you've tried everything, they're not listening, your family members, friends, coworkers, whatever. Part of our message today to all of you is don't give up, because there's always hope in recovery. And you're going to hear stories today that are going to just reinforce that over and over and over again. And one of those stories you're going to hear from is our incredibly courageous leader. The movement that Recovery Reinvented would not be possible without the First Lady. In North Dakota, we're so fortunate to have literally one of the most courageous leaders in the recovery space in the country. She's used her story and created a platform to galvanize hope and change and opportunity for others, like for herself, who took years and years to find her own pathway to recovery. I'm maybe biased because I'm also deeply in love with her, but she is just incredible, and I wish that each of you who has had an opportunity to know through telling her story would even know her the way that I have gotten to know her, because she is the care that she provides, not just on stage, but in the one-on-one conversations that she has with so many people. On the national level, she's had an opportunity to have such an impact. In the prior administration, I think she made 5 or 6 different trips to the White House for advocacy and recovery events. She's been a featured speaker in Atlanta at the RX Drug Summit last April, which is one of the largest conferences in the world. Because of her work, she was invited to join the National Board of Trustees of Hazelton Betty Ford Foundation, one of the largest recovery groups in the country, and now she's the board chair of their advocacy committee. And stuff keeps coming in. She's won a bunch of national awards and recognition, none of which she really cares about. I mean, she cares about making a difference for people like each of you, but she's been asked to participate in another super high profile convening next March. That announcement's not out yet, coming soon, but her presence on the national stage has been not just impressive, but it's been impactful. But as I say, it's even more impressive the way I get to watch her, like last Wednesday night in Dickinson when she gave a talk, and last Thursday night in Williston when she gave a talk, and I get to go along and support her, and it's one of the most fun parts of my job is supporting her when she takes the time to connect with youth, with college kids, with kids in high school that are struggling with the disease of addiction, community members and providers, people on boots on the ground, and she listens to their story and connects with them, and that's just so powerful to see the impact that she's having. And so This is the moment where we've all been waiting for today. It's the moment I can't wait for. I mean, every time I get to hear her talk, I get more inspired about the work that we're doing. But if you could, please help me give a Recovery Reinvented welcome to the First Lady of North Dakota, the most courageous First Lady in America, Catherine Helgas Burgum.